Good morning, everyone. Welcome to the May 16th, 2024 Board of Health meeting. I'm going to call the meeting to order. It is 8:05. And on the agenda today, the bulk of the meeting is going to be spent hearing from staff who will orient us as to all of the important work that all these teams are doing, so that members of this board have a really solid set of knowledge around what this department of health is focused on. And we are also going to welcome one of our new members to the board, Brittany Jones. In a second, I'll let Brittany give a brief intro so we can welcome her. And then Kristen Simpson is going to be briefly going over committees because later this summer, I'll be asking members of the board to indicate their preference for where they would like to serve. So I will let Brittany Jones briefly say hello and share a little bit about who she is before we turn it over to Kristen.
Perfect. Thank you, April. Good morning, everyone. My name is Brittany Jones. I am the Assistant Director of Community Services and Racial Equity Initiatives at the St. Louis Integrated Health Network. I've been working there for about 4.5 years now, and I'm really excited when I got the opportunity to be able to interview and be a part of this phenomenal group. And I see there's plenty of familiar faces on the call, so that really energizes me in this work and the alignment of our passions for our community members in St. Louis. So thank you so much for having me and looking forward to working with you.
Thank you. We're also very happy that you are here. All right. Kristen, I will turn it over to you so you can discuss committees. And I did send a copy of the bylaws to everyone when I sent the agenda. So you should have received it so that you can see per the bylaws what the summaries are for these. But I'll let Kristen go a little deeper since she's had a longer time in service and can talk about what the committees have been focused on.
Thank you so much, April. Yeah, I'll just go ahead and briefly go over the committees. We have 3. I will ask, because we have been through some transition, that I will try to name the leaders of those committees who are chairing those committees. And some of, I don't recall all of them, and I might have some of them kind of confused. So I just ask for your support, board members, to ensure that I'm connecting folks with the right chair if they have additional questions about the operations of the committee. So we have 3 committees. In the bylaws, there's actually, as I talk about the committees, there was an update and one of the committees that happened in March of last year, and I'll reflect that, and I can send that description to you all as the bylaws currently are in the process of being updated, and this portion of it is not reflected on there. So the first committee is Governance and Nominating Committee, which is pretty much your governing body. This committee reviews the bylaws on an annual basis. This committee is also the committee that most of you were interacting with when you became candidates and interviewed and members of the board. They lead our nomination process, which usually is a 60-day nomination period. Well, they'll bring in, they'll review candidates, they'll bring candidates up that they feel like are good fits for the board, and then they'll make board recommendations of putting folks on the board without trying to over-explain what they do. I want to say, Colleen, I feel like Dr. McNichols, are you the chair for that? But you do sit on the committee.
Yes, I'm not the chair, but I am on the committee.
Okay, do you know who the current chair of the committee is? No.
I don't. It was Linda Racklin, and she has cycled off, so I'm not sure who's stepping into that.
Okay, so there could be that you might join and be chair. Who knows? So, come one, come all to the governance and nominating committee. The second committee is the Academic Public Health and Collaborations Committee. I actually sit on that committee. The person that chairs that committee is Dr. Imbal, who I don't think is on the call right now. Basically what that committee is they oversee new academic alliances and academic ventures that are relevant to the work of the board of the Department of Health. This really involves collaborating like our universities, our research institutions, community organizations to develop, parts of it is to develop like meaningful internship programming, figuring out those connections with our partners. The dedicated committee will also oversee the efforts of our academic relationships and fostering synergistic partnerships to facilitate knowledge and exchange knowledge with our academic partners. Okay, and then a final committee. So what you'll see in the bylaws, I think it was the Health Communications Committee, which last year, March 2023, we voted during a meeting to change it to the Community Engagement Committee. And this committee is really to assist in the development of community outreach and stakeholder engagement strategies that advance the goals and priorities of the Department of Health. Through comprehensive research and analysis, the committee will identify target demographics and stakeholders in ensuring tailored approaches that resonate with diverse communities. Additionally, this committee will collaborate closely with departmental staff and external partners to leverage resources effectively to maximize outreach impact from the DOH. I am chair for that committee. And so at some point, as Rapel, what am I saying this morning? I don't even know whose name I was about to call. April, put an R before your name. As April mentioned, you'll get an email that will ask you about your committee preferences. Historically, what we have done is ask for you to prioritize by sending your top preference and then sending an alternative. There could be instances where everybody's engaged in the same committee, and to ensure that we have balance in their expertise in all areas of board committees, we may appoint you to one that may not fit into your preferences. So I do want to set that expectation, but we will try to consider those as we think about where you'll be appointed. And so be on the lookout for those correspondence in the near future. And if you have any questions, feel free to reach out. And I'll turn it back to you, April.
Thank you so much. When I send an email to members of the board asking folks to indicate their preference, we'll also make sure that all of the info that Kristen has just shared is also there so that you can read that. And you can expect me to send that out in the next couple of weeks. Okay, I realize I accidentally skipped an item. We need to approve the April 18th minutes, the Zoom video. So I'm going to ask for a motion. Oh, wait, we can't do that because we don't have 7 people. Never mind. We will save the approval for the June meeting. And we will move on. The next agenda item, I believe, is Dr. Mati. Do you have any specific updates to share, or if not, do you want to move directly into the orientation?
I just want to say that I'm very excited for the orientation. I want to save most of the time for that. So you will get, as you always do, the monthly report tomorrow. Please be on the lookout. I would like to ask that every board member send me an email with just at least one thing that, either that was positive, one thing that you'd like to, that's constructive. We want to make sure that we are providing something that is helpful, not only to our leaders, but to the city. It's trying to strike a balance between increasing health literacy and being very sort of accessible, but also being transparent as well. We will be working with a consultant firm. We have an RFP out to develop more formal RFPs and data points. This monthly report is something that I introduced under my leadership. It's never been there before. And so we understand that some of these metrics are very, very basic as well. Lastly, it is my hope that we will start to provide these to you before board meetings, but it is really hard on the team. The managers have to get them in time for for the comms team to get them prepared and get them out. So I don't want to promise that too early, but we are working on that because we know it would help the discussion at these meetings. But outside of that, I'd like to thank Erin Ford, who is the one that puts these reports together. You will meet her soon. And her trusty leader, Shantae Llewellyn, is on the call. You will meet her during the orientation. I'm really looking forward to you meeting this incredible team that I believe, as if anyone has met me and knows me, my famous quote is the best team in the land. I stand by it, 10 toes down. Other departments and other places can just be in their feelings about it, but I truly do. And you will continue to see why while you're on this board. So back to you, board chair.
Thank you very much. All right, I'm going to ask that for the sake of time, as the orientation takes place, if folks could, if you have questions or comments, perhaps wait till each section of this is done. So maybe not in the middle of folks speaking, asking questions, but waiting till folks have a chance to complete their piece before asking any questions. And I look forward to hearing from everyone and hopefully getting to meet those that I have not yet met. So, Dr. Mati, how would you like your team to
Thank you.
move
We
forward?
can get started. I'll be doing the beginning of the presentation when we get to different bureau chiefs, the bureau sections. I will introduce the bureau chair. They'll introduce very briefly their teams. In the interest of time, we're going to have them spend no more than 2 to 3 minutes on their sections because we believe an organic opportunity for y'all to ask questions at the end. I'd like to ask that everybody stays engaged. It's really important. This is the newest board we've had in decades. And so I believe that this will be really instrumental in some of the gelling, socialization, and more importantly, the understanding of where we're going. So let's get started. This is the City of St. Louis Department of Health orientation. I just want to welcome everyone. I want to thank my team for their dedication to the city, but to our new board members, really your presence with us indicates just a legacy of professionalism, of service, and of leadership. We will be discussing the Department of Health strategic plan, mission, vision, and core values. We'll give you updates regarding our work in the reaccreditation process, and then we will then go bureau by bureau discussing the functions and programs of the City of St. Louis. So let's start with the mission and vision. We have just gone through a reaccreditation process, a 3-year process. Is Rhonda Bartow on the call? If she is not, she is the person that should get her flowers. Many of the board members that are not new know Rhonda well because she came to this board, made sure they were engaged. Every member of this board looked through our draft reaccreditation documents, and detailed comments were just really incredible. Many of our board members actually serve on the CHIP committees and implementation teams. I see Brittany shaking her head, so this is not something that is new to those of you that have been doing this work. Nodding your head, not shaking, girl. And so the mission and vision has actually been updated under my leadership. So a little bit about me. I took this role in October 2021, and Rhonda Bartow had already started the process of reaccreditation. This mission, in partnership with the St. Louis community, we will promote and improve health and racial equity to assure optimal health and well-being for all people. Our vision is St. Louis, an equitable community for all to achieve their optimal health and quality of life. And our values are depicted at the bottom of the stream: racial health equity and health equity, data and results driven, integrity, leadership and professionalism, community engagement, and systems level change and collaborative approach. And I stand by that. I believe that my team embody that every single day. So the new strategic plan will be a 5-year plan. We just submitted our reaccreditation application with the county. This was a regional effort with more than 50 community-based partners serving the committees that you'll hear about. So this will reflect FY23 to FY27. Our 4 priority areas are to advance health and health equity, solidify our foundation, modernize data infrastructure, and expand behavioral health. So let's talk a little bit about what we've been doing around accreditation and improvement plans. I'm really proud of the work that the team did. We found a consultant to come in and help to really serve as a mediator within the department. Every single member of the staff were involved in giving feedback as to what they believe the priorities are. The executive leadership team I worked with extensively around that. So what you are seeing is a real reflection of what we believe this should be. We then worked with the county and our community partners. So this really reflects the work of the people that are responsible for implementation, who do this work every day in our boots on the ground. So as far as our purpose, what we came up with after this very rigorous process is to advance and transform public health practice through performance improvement and innovation, and by building a strong infrastructure and culture of quality. You're seeing a lot of intentional things here. You have to understand that we were coming out of a global pandemic. Public health workforce lost 150,000 people by the end of 2021. And you've heard me say on my soapbox many times, I inherited a budget of less than 1% in 2021 of the city's budget. We are 52% grant funded. And when you compare us to cities the size of St. Louis, we have at least a quarter the size of the health department. And I say easily that every member that works for the health department is doing the job of 3 to 4 people. And so those intentions around, if we could go back, please, those intentions around performance improvement, innovation, and culture of infrastructure really speak to the really difficult position this health department has been in and had to weather through COVID. For standards and measures, we have those based on foundational public health services, and they model. We built a model and the 10 essential public health services as well. The application for reaccreditation has been submitted, and we have some diagrams for you as well. Shantae, I know you were instrumental in this process before your well-deserved promotion. I just want to check in to see if there's anything you wanted to add before I move on.
No, ma'am. Just to give kudos to everybody on our team or in our department for their efforts and putting together and compiling that submission. It was not, it was definitely a heavy lift. And we just look forward to our responses from the FAB Accreditation Board and their upcoming visit. There's going to be a visit. That's the next step in this process. So we will definitely keep you all posted on our progress. Many thanks,
Shantae. Moving forward. So the plans for improvement under this new plan are QI. Rhonda, like I said, was a QI Bureau of One. In every budget proposal that I've given in the last 2 years, I have proposed an Office of Quality Improvement and Strategic Planning. We were very fortunate in being able to recruit and now have the Commissioner of Health, Victoria Anwuri, who is just over 20-year veteran and leader in public health, and who brings strong leadership around QI, strategic planning, fiscal management, and grants. She is an incredible partner. And so she has really been the one that I wanted to be able to, she's really championed that quality improvement plan. But we have been slowly building that team and are yet to be able to really get support for that bureau. So I will be coming to you for support for that the third time we come around next year. Strategic plan, we've worked on our strategic plan that I said the board was involved in providing feedback, a workforce development plan, performance management system or plan that has been really instrumental in building some of the backbone around infrastructure within our department. And lastly, this culminated in a community health improvement plan that I believe we circulated to you all, but I will, when we provide these slides after this meeting, we will provide you with that community health improvement plan. Next slide, please. So if you look at how this started, we started with a very intentional community health assessment. Again, that was a regional effort in partnership with our county partners. And so this was mobilizing for action through planning and partnerships framework that we used. And that had a couple of components: the community health assessment, a forces of change assessment, local public health systems assessment, and community themes and strengths assessment. So a very data-driven approach. I really encourage you to spend some time with the infographics that the team worked on over the last couple of years that really will walk you through what this then mapped out, right? Organizing for success, visioning, all of the assessments that I just subscribed, and then identifying strategic issues out of those assessments that then informed our goals and strategy, and through a constant framework of QI with evaluation, planning, implementing action cycle. And so those findings contributed to the final chip that, again, I believe most of you have access to. I'll ask one of the members of the comms team to put the link for that. I understood that the website was down a few days ago. My hope is that it's up, but if not, we'll get you the final document either way. So what did this result in? Our CHIP priorities, and these represent the committees that have now been established through our regional partners. Those are health and economic mobility, chronic diseases, maternal and child health, violence prevention, and behavioral health. What I'm really proud about is that we, in really trying to move forward from this siloed approach to priorities, there were cross-cutting themes that were established because we believe those needed to be embedded in each committee and really have really encouraged, pushed, and have great leaders in each of these committees to keep track and to be mindful now that we are moving into the implementation phase of this, of these cross-cutting themes. And they are racism and equity, access to systems and physical accessibility, interventions across the lifespan, participatory, community-driven approaches, and being trauma-informed. Next slide, please. So what did this result in? St. Louis Partnership for a Healthy Community, this public health system that represents collective impact. Within this, you see the common agenda, shared measurement, the mutually reinforcing activities, continuous communication is integral to this actually happening, and a backbone support of supportive agencies. This is truly an effort that represents the fact that we know that we are not just two health departments that implemented a CHIP, that this is actually an opportunity to develop an ecosystem of collaborative partnerships and support that then are served together to collectively do this work. And so really proud of the work that's been done here. Next slide, please. All right, we're going to get into our bureaus. So first up, I want to introduce our newest bureau. This came when I first joined the city. The priorities that the mayor presented me with were, violence prevention, behavioral health. I added maternal child health as well. And when I walked in on my first day, was horrified to find out that there wasn't one person hired to do those first two priorities. The mayor then took the initiative to open the Office of Violence Prevention, external to us, that we feed into. Prior to that, we were the subcontractor for all violence prevention initiatives. That freed me up to work by the end of my first year to bring to the budget a proposal to have a new bureau. In the first year, we got enough budget for 14 salaried positions. Last year, we got a little bit more operational costs, and we continue to grow. So I'd like to introduce the inaugural bureau chief for the Behavioral Health Group Bureau, Dr. Julie Gary. Julie, if you could introduce the supervisors that are here with you from your bureau, and then proceed with your presentation, please.
Absolutely. Thank you, Dr. Mahdi. Good morning, everyone. My name is Dr. Julie Gary. I have on the call with me today the head of my education and training team, Elena Patrick, and the head of my criminal justice and crisis response team, Anastasia Wright. Next slide. All right, so as Dr. Mahdi mentioned, we are a pretty new bureau, and this was the projected kind of organizational chart for the bureau. Right now, we have a team of 9 doing the work. So we have a linkage to care team, an education team, someone who's responsible for outreach and Narcan, which we all do. That outreach, we have someone who's in charge of our coalition, and then we have a criminal justice and crisis response team. So we have some open positions looking to hire as soon as the hiring freeze is lifted. In terms of what we set out to do back almost a year ago now, the vision was to pursue the holistic healing of St. Louis families and communities by overcoming obstacles to them experiencing their highest optimal mental health and well-being. So you can see very aligned with what Dr. Mahdi mentioned as the overall vision and mission for the department. And then our mission, strengthening relationships, resources, and action with community partners to promote awareness, availability, and equitable access to culturally competent behavioral health options. You also notice at the top there, the mention of the equity plan and economic mobility. I just wanted to point out that prior to moving into this position, I was involved in writing the equity plan for the department, which Now I'm working with the new epidemiologist that's working on progressing that plan. And I'm also the co-chair for the economic mobility team for the CHIP action team. So if you're interested in joining that group or understanding what we're doing with that group, please feel free to reach out to me there as well. Next slide. All right, so when we started this, we were working with the Centers for Disease Control and Prevention, and these were the initial objectives for the department in terms of the Behavioral Health Bureau. And I can truly say that we did have those products when we first started the Bureau, and we have worked judiciously to advance each of these in terms of mapping our metrics, our strategic and implementation plan, which we just reviewed again, going into our second year, and then the health equity roadmap, which we're working in conjunction with that new epidemiologist. Next slide. All right, so understanding our core focus, which I mentioned briefly on that org chart slide, our focuses are linkage to care, education and outreach, and really just increasing awareness about what we do and what services we have available. We're also involved in drug storage, disposal, and monitoring, a Narcan program, as I mentioned before, expanding access to treatment, which is a big focus right now on a potential project with SAMHSA. We're also involved heavily in the criminal justice system through the Criminal Justice Coordinating Council, the City Justice Center, and we work heavily. I do have an epidemiology background, so work heavily with my assigned epidemiologist on how to really show our metrics, how to measure what we're putting out in the community, and how to measure any of the outcomes that come from the interventions we're putting into place. Next slide. All right, so what is our initial progress? So we've had over 275 linkage to care calls in the community per month. Right now, it's averaging between 20 and 25. Every staff member has received at least 10 mental health and substance abuse training courses and is peer recovery support certified. I can honestly say my team every week is bringing me new training opportunities, either for them to attend themselves to become more adept at their job, or other ideas for us to put out as training opportunities for our community partners or our staff. We've handed out more than 2,500 doses of the overdose drug naloxone. We've participated in more than 140 community outreach events. Our goal is to be out in the community 2 days a week. Typically, we're out 4 or more days a week, and we kind of spread that, everyone from me to our public health program reps doing outreach. We do citywide employee crisis response, Narcan, burnout, and self-care training. Our next training is on June 11th. If any of you are interested in coming, we'd love to have you there. We've awarded more than $1.6 million to community organizations doing critical behavioral health work. That has come through ARPA funds, opioid settlement funds, and overdose to action funds. I'm happy to share kind of who those organizations are that have received funding if you're interested. And then we're also involved in that NCCHC audit process that's just started in the City Justice Center, serving on 2 committees there. That's it for me. I'll turn it over to communicable disease.
Thanks, Julie. So proud of the work of you and your team. Up next is communicable disease with a seasoned veteran that leads them in Suzanne Alexander. Over to you, Suzanne.
Seasoned veteran, that sounds so exciting. I've actually only been with the Bureau for 4 years now. So
That's your career, sis. Don't do that. Your career. You're not new to this. You're true to this now.
well, but this is truly my heart. I have on the call with me today our transitioning Bureau Chief for Communicable Disease, Ms. Veronica Roy, who has served the city for over 30 years and who will be stepping into a program that I am proud to say over the course of 2023 and 2024, we have finally gone from 53% staffing to over 85, thanks to the hard work that Dr. Mahdi and Commissioner have given into hiring. And it's very exciting for us as we're able to move forward and do more things. I also have hired a CD supervisor for our investigation team. For the position was open for almost a year until we found the right person. And unfortunately, she's not with us today. Her name is Regina Sullivan, and I look forward to you all meeting her very soon. In addition to the investigation services that we provide, we are also the regional lead agency for HIV prevention efforts under HRSA, which would be our grants administration section with the St. Louis we are the transitional grant agency for the Ryan White HIV/AIDS program for people living with HIV, as well as the regional lead agency for the HIV prevention efforts under the CDC. So we've got two separate funding streams, and we work hard to make them work together as an interdepartmental effort. Under our HIV and STI testing, you all might be familiar with the Health Stop, as well as our fabulous outreach team, who is set this year to put on the biggest and best Pride STL testing lane, we're calling it. We were looking at sexual health area, sexual health block, testing lane kind of is what seemed to stick, where we'll have all of our sub-recipients, that would be Washington University, Williams and Associates, the Spot, a variety of our partners out doing testing at Pride STL. We also have the custody of medical records, some going back as far as Homer G. Phillips, as well as the CHIPS. I'm sorry, Regina, I didn't know that you'd actually made it in. I didn't see you. And our perinatal hepatitis B programs, our disease surveillance program is separate from our investigation program in that it monitors the testing and health conditions for people living with HIV. And last but certainly not least, as we have worked so hard to keep our tuberculosis clinic going through the pandemic and after, and that is led by Nurse Tracy Campbell, who has brought a new vision and greater clinical stringency to the clinic. And we're very proud of that program as well. Next slide, please. So what does that mean? As we have shifted from a COVID-19 response to our, I don't want to say run-of-the-mill diseases, because that's not a great way to put that, but we finished out 23 with the largest Mpox vaccination clinic in the city of St. Louis, well, actually in the state at the time. And until just February of 2024, we had not had any Mpox cases in over a year. I mentioned Pride STL before, as well as National Public Health Week, where we do a lot of engagement with our external partners and community-based organizations to really bring awareness of infection prevention to the city. We have worked hard on our social media messaging through our comms team, and with the help of our newly hired outreach programs. We've got a couple of amazing certified health education specialists in our HIV prevention department who has helped not just with Mpox, but also putting out information about how Shigella can be sexually transmitted and other illnesses that we are monitoring closely. And that's one of the exciting things. Our epidemiologist, David Courtney, has helped us kind of keep an eye on what could be coming to the communities. And we have recently established our conditions of concern, which is an informal briefing. It's run, of course, through our very own world famous infectious disease expert, Dr. Mahdi, to make sure that we're getting the information out to people when they start hearing about, for example, the measles outbreaks that happened in Chicago. We also had a tuberculosis outbreak in California. How are these things going to affect our society, our city? So we've worked very hard on that. And we are proud to say that we are ramping up our testing and outreach efforts. We have had at least one event a week for the entire year so far, and we're not looking at slowing down anytime soon. Next slide, please. All right, so some of these numbers I didn't take a close enough look at. I'd like to say that our investigations have been really ramped up, and we now have had, for the 2024 so far to date, we've had a 95% closure rate on our cases. We've also handled a tuberculosis exposure. We've also handled a pertussis cluster and a scabies outbreak. And this is while we're still missing 2 investigators. And that is a credit both to having a strong CD supervisor and also having just an amazing team in our department. So our clinics all work closely together. And when we had our tuberculosis exposure, the investigators went to the site and helped the TB clinic staff work through the contact tracing and the testing for that. I'd also like to mention that we have worked on and we've initiated a interdepartmental congenital syphilis task force, which is staffed by pretty much every bureau in the Department of Health. And we work closely with the State Advisory Board as well as St. Louis County to ensure that we are finding best practices for preventing the transmission of syphilis between mother and child, and also to figure out what the barriers to, and I'm going to use a Kristen term, capacity are for our pregnant people who are at risk of having a baby with congenital syphilis. How do we increase their capacity for treatment? How do we get them the social supports that they need? And that, I believe, is it for me.
Wonderful. Thank you so much, Suzanne. Really just want to give the CD team their flowers. This is an incredible bureau, and we're the backbone of all the case investigations, education, really being the boots on the ground throughout COVID. So Ms. Veronica, who's coming in as Suzanne continues to elevate within the health department, and that announcement is coming soon. I just want to give her her flowers on this call. She's one of the longest serving people within the department. And we're truly excited and will benefit from her leadership. So I honor you, Ms. Veronica. We have some incredible supervisors. Mr. Gina, as you can see, is on the call, and Tyrell Manning, who's just a force, will be going to DC, was selected because of his leadership that is growing to testify on Capitol Hill around ending the HIV epidemic efforts. So we wish you Godspeed, Tyrell. Super proud of you. He's also the fearless leader for Pride, which is one of our biggest events. So I did want to just pause a little bit so that you understand the magnitude of where they've come. And when you look at the numbers that they presented, what they continue to do to serve the city. So we will be moving on to grants administration. Commissioner Ann Worry oversees a lot of the bureaus here. This is one of the ones that she does. Sylvia Jackson Bell, who unfortunately is not in right now, is the bureau chief and is not here. I don't know, the commissioner may not be in a position to come off camera, so I just want to see if she is, and if not, I will walk us through grants administration. All right, it's on me. Let's go. So the Ryan White HIV/AIDS program is overseen. Part A is our federally funded dollars that the health department is the lead for on behalf of the city of St. Louis. And so the Grants Administration Bureau oversees those. These funds are to provide assistance to eligible metropolitan areas and transitional grant areas that are most severely impacted by the HIV epidemic. So Part A funds are used to provide core medical services and support services for people living with HIV as the last payer of resort. This is one of the most historic, equity-minded programs for the HIV/AIDS epidemic since its inception in this country in 1985. And so what does that include? Sorry, please go back one. What does that include under core medical and support services? It's a host of things that they oversee and are responsible for distributing these critical funds for the regions that are highlighted on the map. So outpatient ambulatory health services, oral health, early intervention services, emergency financial assistance, food bank and home delivered meals, education, risk reduction, insurance, housing, legal, linguistic, medical transportation, mental health, medical case management, nutrition therapy, psychosocial support services, and referral for healthcare support services. The Ryan White program, as many of you know, has been sort of the blueprint of what wraparound services, linkage to care, and addressing social and structural determinants of health has looked like for healthcare. And so we're very proud to be the Part A recipient and to have a leadership role here. Sylvia has completely revolutionized this bureau since she took over, and I promoted her about just under a year into being here. Next slide, please. So one of the big parts of what they do as well is the HOPWA program, which represents housing opportunities for persons living with AIDS. This is a program that again is federally funded and dedicated to the housing needs of people living with HIV and AIDS, one of the most critical social and structural barriers that people face. The program is managed by the Housing and Urban Development HUD office, who we have a really great partnership with, and was established to provide housing assistance and related support services for low-income families. So that has been really critical for this bureau. Commissioner Anwuri was taking a call. I will let her kind of wrap up this portion when she comes back if she's able. Next slide, please. So Commissioner, I don't know if you're in a position to just say a few words, your leadership here, and that of Sylvia has just really revolutionized the GA section.
No, I think you covered it. Thanks, Dr. Marty.
Absolutely. Okay. Next, we will hear from Shante Llewellyn and her mighty team around community outreach and public information. So you've heard Shante's name. She is another promoted individual and rock star within the department, previously working around QI, helping to lead all the efforts around reaccreditation, and then is now probably the newest manager in the department. We had two PIOs, Harold Bailey, who resigned, who retired. Let me give him his flowers after I think 17 years, and Kimberly Vandenberg, who most of you know well. And Kim was promoted to a supervisor position, has built out a team. Shante is coming in to oversee them and to build, and will be announcing her new community outreach and public information strategic plan in the coming weeks. So look forward to that. So over to you, Shante, to introduce your team.
Thank you. I just wanted to, my name is Shante Llewellyn, Health Services Manager 2 over Community Outreach and Public Information. And I just wanted to take a quick moment to share with you or to provide Kim, who is amazing, an opportunity to tell you about one of the functions of our community outreach function. It's actually made of three components. It's our health communications and health promotions, as well as our community health workers, and then our overall community outreach for the entire department, including our new health vehicles. But I definitely want to give Kim an opportunity to share the great work that they do within our communications first, and then I'll follow up with that.
Thanks, Shante. Yes, public information is critical to making sure that we get the great information that all of our bureaus that you're hearing about today, getting that information out to the community. It doesn't help that if we silo that information here, because that takes the public out of public health. So public information, we look at, we're one of the 10 essential public health services with health promotion, education, and marketing. We work with internal and external messaging. This is making sure that the information that we need to get to our staff gets distributed through our internal email system, as well as making sure that we're reaching that public through different channels. The community outreach, as Shante mentioned, social media, press releases, working with media sources, public Post Dispatch, the local TV outlets, radio outlets, making sure that they have accurate information that they can share, so the community can hear it from multiple angles. Public relations, we work on making sure that the department is seen in a, I want to say, positive light. For example, Dr. Mahdi just presented to the Budget and Public Employees Committee meeting for the Board of Aldermen earlier this week. And so communications worked on lifting up that presentation through support of PowerPoint and information from the bureaus. And thank you to the bureaus for your contributions to that. And media relations, as again, I talked about working with local media, garnishing those relationships, being able to have the ability to call an outlet to say, hey, we've got this story that we're working on, or we've got an idea for a story. Or on the other side of that, if they're feeling that they can come to us as a trusted messenger in public health, and being able to share information through interviews and press releases. We have been working quite a bit over the last couple of years on increasing our accessibility. This is actually something that we're looking at not only just public health, but citywide we're working on. And so we're really trying to strive to make sure that those who may have low vision and use screen readers are able to may have accessible information to them. So if you follow us on social media, which I encourage you to follow us if you haven't yet, we are truly trying to make what's called alt text, something that we are working with every single post. And this is simply a text version of what you see in an image. You'll see on the image there on your right, each of those pictures has a little ALT icon on it. That means there's alt text contributed to that. So if you are someone who uses a screen reader to read your social media, to read your website, you'll get a verbal description of what you see in the image. So for instance, one of the image descriptions is City of St. Louis Department of Health Behavioral Health Bureau and Community Partners, Sisters on Guard that's who is in the photo. That is the public information side. Again, we're working on expanding our community outreach. We took a little bit of a hit during COVID. During that, in terms of a lot of events were canceled, postponed respectfully, as we were all trying to social distance, but we really have seen an increase in asks for the department to be back out in the community. We're actually going to be planning to be out in the community twice this weekend. And so that is the purpose and the need to have an expansion, but Shantae's position to ensure that the department is streamlined and is working towards a cohesive approach with that community outreach.
Make sure that I'm on here. Thank you. Thanks, Kim. So you've learned a little bit about our communications section, but there's actually 2 other functions that I'll be leading, or I am leading, and it's our community health workers, the efforts surrounding that, as well as our overall outreach for the department. That includes the use of our health outreach vans. As relates to the community health workers, through grant opportunities, for background, the department recently enhanced our maternal child health program, as well as Behavioral Health Bureau, by hiring additional community health workers who are certified through training at St. Louis Community College and are recognized as community health workers by the state of Missouri. Within both maternal child health and behavioral health, there are community health workers and a supervisor who perform critical tasks to support overall efforts. Now, through our function with community outreach, we'll be identifying opportunities to support the overall efforts
All right,
of the
Shantae,
community.
can you advance it to the next slide while Shantae's talking? Thank you so much. Apologies, Shantae.
Oh, no worries, no worries, no worries. Now, through our community outreach function, we'll be identifying opportunities to support the overall efforts and identify ways to enhance their role within the department and ultimately the community. As you know, we have always been out in the community. We would love to meet people where they are. We've been known for our efforts just internally, as well as our opportunities, or the presence that we have with our community partners. Within this new function, we're standardizing our efforts to ensure we're able to better understand what our outreach looks like and have the ability to continuously identify ways to improve. As a matter of fact, and I'll get a little bit more into that in just a second, but to date, since this outreach season has started, we've already participated in over 47 events across the city, as well as had direct contact and interacted with over 2,854 individuals, constituents, loved ones in our community. And we look forward to many, many more. As Dr. Mahdi mentioned earlier, I am happy to share that by hopefully next meeting, we'll be able to share with you the Department of Health Community Outreach Plan. In the plan, you'll learn about our goal, which is to improve accessibility to health information, resources, and services for the St. Louis community by applying equitable, evidence-based strategies to promote public health. You'll also learn that there are elements in the plan that have already moved forward. For example, in 2023, DOH initiated a quality improvement project to overhaul its approach to tracking community outreach efforts. This new system aims to capture data from all bureaus comprehensively, facilitating ongoing evaluation and allowing for fine-tuning of our outreach strategies to better meet the community's needs. Based on the data, we now know what areas where we have been most impactful so far, even this season, as well as areas where we know we may need to think about focusing on next. The Community Health Engagement Plan also outlines strategies that will demonstrate how DOH will be able to support efforts within the Community Health Improvement Plan by supporting each of the priorities and by increasing awareness and attract more partners to the community health improvement plan action teams. So with all of that said, thank you for your patience. Stay tuned to the many great things that will be coming from our team.
Fantastic job to the comms team, to Shantae. I cannot express to you how critical this bureau is. We're the only department outside of the mayor's office that has dedicated PIOs. Certain departments have just now advocated for them, but health has been the blueprint, the lead, supports other departments. What Kim and Harold started and what Shantae has elevated cannot be underscored. Additionally, Shantae's, what she talked about, I really need people to key into right now around community outreach. We have not had a cohesive and strategized plan. And in the last 2.5 years, we have not just become regional and state leaders, we've received national acclaim on multiple areas. And so having a dedicated community outreach that standardizes and has these protocols for how we work internally and externally has been beautiful to watch Shantae build in real time. So Shantae will be someone that you will connect with. One of the committees, as you know, specifically is named exactly aligned with what she does. And so I really encourage those of you who do sign up for that committee to make sure that you meet with Shantae and that you use her many, many years of experience and the strategic vision that she has built. She's literally built a strategic plan that the first time she sent me a draft, she didn't even want me to look at it, but I was so excited. It looked like it was finished then, but the kind of person she is, when you see this plan, it will really help inform that committee. So congratulations, Shantae. Moving along to another seasoned veteran in Justin Hauser. Justin is just, for me, a really good human and a great leader. We share having young ones that are almost exactly the same age as well. And so we often lament in having to lead, but also take care of little ones. And I think what you should really key into when Justin starts this presentation is he has the most diverse bureau you've ever seen. He has multiple sections that are not always incongruent, but all fit under environmental health. He also does, very few of our bureaus have enforcement capabilities or even actual legislature or codes policies that the cities have that they adhere to. So there's a lot of really important foundational work that people don't really think about with public health that Justin will be speaking to. So over to you, Justin.
Thank you for that introduction, Dr. Monty. Good morning, everybody. Justin Hauser here, Environmental Health Bureau. Also representing environmental health on the call this morning is our program manager, Dr. Patrick Nabian. Just rolling into the environmental health services that we have, there are 6 different sections. And as the director mentioned, we are primarily focused on regulatory and enforcement activities. So we have air pollution control, animal care and control staff, we have community sanitation, food and beverage control, as well as vector control folks. And then rounding out the team is the 6th section, we have emergency preparedness, not as focused on regulatory items, but still just as important. Some of the images here, we've got an animal control officer that looks like they're doing some community engagement with a puppy here. There's also a building demolition going on. The important thing to note is not the impressive cloud cover in the picture. There's actually a misting system that's going on to help reduce the dust and particulate matter from the building demolition. And then the lower portion is just an example of some of the situations that our inspectors find themselves in when they're out and about in the community, enforcing different regulations about improper storage of tires and accumulation of rubbish and exciting things like that. So moving on to the next slide, we'll just talk a little bit of the numbers here from 2023. For air pollution control, they have conducted inspections for demolition on 199 projects. The animal care and control folks, over 5,100 service requests to enforce animal ordinances. This could range from just animals at large to dog bites, animal welfare situations. There's a pretty broad spectrum of calls that our office receives when it comes to the animal related issues. The community sanitation inspectors have conducted over 1,000, looks like 1,019 inspections were conducted for 2023. Food and beverage control has over 7,000 inspections, and this includes the temporary, like special events and festivals, for example, as well as annual inspections for food establishments, as well as the new opening inspections for food establishments in the city. Vector control, we have one staff member. Roger Williams is the sole guy running the vector control program. And last year he responded to 519 service requests. These are primarily focused on rats and mosquito calls.
Sorry,
Then
can we just really just pause there to shout that out? Because guess what couldn't be me, the sole guy doing that. So shout out. Sorry, Justin. I just, that gave me the weebie-jeebies, and so we honor his service.
I will highlight Roger's efforts any opportunity that I get, and I'm sure he appreciates that as well. Thank you, Director. Rounding out the updates, emergency preparedness, we were closing the COVID-19 vaccine campaign kind of in alignment with the commercialization of the COVID-19 vaccine and the most recent variants released for that. 41 vaccination clinics, that was 1,249 total immunizations for 2023 for the emergency preparedness section and the COVID-19 vaccine campaign. They also held a Stop the Bleed training for the Medical Reserve Corps volunteers. This is just a basic first aid and trauma response class that the MRC volunteers go through for their annual training requirements. Moving on to the next slide, I think we'll talk a little more about emergency preparedness. There are two main funding sources we received. It's passed through federal funds through the state, the Public Health Emergency Preparedness Grant, as well as the City Readiness Initiative Grant. Now with those funds come some requirements. So there are a few things that we have to participate in order to receive and be eligible for the funding. The Operational Readiness Review is a biannual review from state staff. They come out and they look at our plans and make sure that the things that we say we do, we have those plans operationalized and we actually perform those functions. The Partnership in Readiness Exercise Program is a very similar program where they come out and we'll do a 2-day functional exercise where we just walk through what if scenarios and we actually test what the plan says. If we pick up a phone and call a number that we're counting on for dump trucks, that somebody actually answers and says, yes, we have your dump truck. The last item is the 15 core public health capabilities. And then that kind of leads into this next slide. Some of the program components, the all hazard response plan, this leans back into those 15 core public health capabilities. They range all the way from community preparedness through medical countermeasure dispensing, and then to volunteer management, which leads us into the Medical Reserve Corps. Abby Munez is the staff member here at the Department of Health that manages the Medical Reserve Corps. This is a pre-registered group of volunteers that self-identify. They participate in trainings as well as events. Now, while the name sounds very clinical, the Medical Reserve Corps, we have both clinical and non-clinical volunteers because boxes still need to get moved, trucks still need to get driven. So the group of folks, it's not just medical volunteers, we have non-medical folks as well, but the name, the branding kind of sticks with the Medical Reserve Corps. They also develop plans for public and private points of dispensing. We also test and operate redundant communication platforms in case on a bad day, not all the cell phones are working. We have amateur radio as well as statewide radio networks that we have equipment, and we test those regularly, including internal systems for message redundancy. The emergency notification system. This is used for all staff in case there's a message that needs to get pushed out in real time, in case there's inclement weather, in case there's a building closure, any type of message we want to get to everybody as quickly as possible. That's what the emergency notification system is used for. The last item here just lists a few of our partnerships with Heat Up St. Louis, providing utility assistance. We coordinate with the Missouri Department of Health and Senior Services for fit testing programs for N95 respirators, and then as well as the collaboration with STARS and the East-West Gateway Council of Governments. And that looks like the end of our slides. So I look forward to some engaging discussion at the end of the presentation. That will end my report. Thank you, everybody.
Many thanks, Justin. And I just wanted to say that he gave you the numbers for just 1 year for COVID. Justin, can you tell him the total number of vaccines approximately that your team was responsible for spearheading for the entire pandemic on behalf
Well, I wouldn't want to make a number up, so I'm going to talk as slow as possible and try to pull up the vaccine administration log here, just so the number that I give is the most accurate. 46,013 vaccinations is the number.
So there's so many metrics that we can use, but I need you to understand that this is with a very small team. Justin had to then help lead collaborations, volunteers to do that at the Dome, in community, churches, rec centers, schools, wherever we were asked to go. and then to transition back to all those foundational, very broad sections. We really honor the work of Justin, his team, and the entire Bureau for the pandemic, but 46,000 for the kind of workforce capacity issues, lack of resources, and lack of budgeting that I described earlier is not a game. I have the best team in the land, and that's period. Next, I'm really proud to represent the only person who has more degrees than me in this department, Dr. Dominic Moshe, who is the chair of our Epidemiology Bureau. My staff are sick of me for a number of reasons, but one of my other pedestal repeated things is saying that at its lowest, we had about 2 epidemiologists, and we have a fully staffed team. We've grown the efforts, and I'm really excited for him to share some of the exciting data-driven things that he is doing within EPI. Dr. Moshe?
Yeah, thank you, Dr. Mati. Good morning, everybody. Yeah, I would like to start by saying that the Epidemiology Bureau is more of a cross-cutting, bureau that supports all bureaus in the department, and the bureau has grown over the last 2 years. Expanding from 4 to 8 epidemiologists and 1 program analyst. So this is quite remarkable in our last 2 years. One of our main activity, to begin with, is collecting and analyzing data, as well as generating reports. This goes across all the program areas in the department, including communicable disease, chronic disease, mental health, and the like. Another activity in the Bureau is conducting disease surveillance, both active and syndromic surveillance. This actually goes with conducting outbreak investigation of diseases and specific conditions in collaboration with the CD and Environmental Health Bureau. Next. At the epidemiology, actually, we are providing technical support to our stakeholders, both within and outside the department, in terms of responding to the data need, generating reports, reviewing policy briefs, and so forth. Last but not least, the Epidemiology Bureau is conducting and contributing to research, mainly in collaboration with our academic partners. Here I'm referring to SLU and WashU. So that's just in brief, and I'll be happy to respond and clarify further what we are actually doing at the end of the session. Thank you.
Man, a few words, but multiple outputs. One of the things I'm proud of is there is no program that is represented that doesn't have a data-driven approach. They give reports to everyone. They support their projects, grant submissions. The implementation of the report you get, that's Dr. Moshe's team making sure that those numbers track. We now get requests from across the region and state for data support because of how strong his team is. And the work of health equity cannot happen without data. Dr. Corey Bradley, my friend, always says data is justice, and Dr. Moshe's team lead those efforts. Really excited to provide you one of my favorite people, Bureau Chief Bobby Williams, Family, Community, and School Health. Just an incredible he for she advocate, very passionate about the work of health equity. So Bobby, looking forward to your portion.
Thank you, Dr. Mati. Good morning, everyone. My other managers, we have Nurse Gwen Thompson. She's actually out on vacation, so unfortunately, she won't be with us today. And then also Lakiska Stevenson, she's actually out in the community doing one of our men's health programs, which I will explain or talk about that later. So unfortunately, she won't be with us today, but they're both very instrumental in what it is that we do in family, community, school health. And then our last manager that we do have is Nurse Daryl Finch. And unfortunately, Nurse Daryl Finch is dealing with some personal issues, so he's unable to be here this morning as well. And most of us are aware of that, what's going on with that. So maternal and child health, let's see here, right? This is the VIP of all of our programs right now. Dr. Mati has been very
VIP
and a very good leader in helping us to really bring national attention, not only to the status or the state, I should say, not status, the state of maternal and child health, not only in the state, but really, localize it here in the city of St. Louis. So we've already had national agencies like the National Medical Association. We've already had HRSA here through the Advisory Committee of Infant and Maternal Mortality. And we've also had national attention brought once again on this important topic with our partnership with the Black Nurses Association and the baby shower that we performed here not too long ago. And if you thought that that was it, you're wrong. We have more coming. We're currently right now doing a maternal and infant mortality rate campaign. So we have a lot of billboards already up in partnership with the city, STL, I'm butchering the name, STL TV. Thanks to a large part with our health promotion team who's already gone before us. Really appreciate Shantae and Kim and Ivori and Aaron for all their help with this. But you can see our billboards up in zip codes like 63107, 63115, and 63118. And you're gonna see them actually throughout the city, but those are the zip codes that we identified with our EPI team, thanks to Dr. Moshe and also to our EPI appointed to us, Abby, and also Matt Haslam helped out a lot with this, identifying the zip codes of the highest need so that we can positively impact maternal and child health rates. And then also, that's not it either, right? So I told you maternal child health is our MVP right now, our program. We also have ARPA funds, and we have CDA funds that we're looking forward to implement for this particular section of our bureau, where we're going to incorporate more doula services, more evidence-based and evidence-informing services to really help positively impact those dismal rates that were identified in a lot of the national and local reports concerning maternal and child health in not only St. Louis, but in the state of Missouri, actually in our greater nation as well. Lead screening programs this program is very important. We do a lot with blood lead screening in the schools from 6 months to 6 years of age. So we have a very involved partnership with St. Louis Public Schools, with our private and parochial schools, and we're always looking to see how we can expand our reach and work with our other school systems. Anyone who is familiar with the school system in the city of St. Louis, we know that we have many avenues that road transverses down. So we're trying to work with charter, magnet, anything that we can to help keep these rates low. And then also we have our school health team. We focus a lot on ensuring proper immunization and vaccination rates amongst our school-aged children. We do a lot of outreach in the community to help advertise this. We have a partnership with one of our federally qualified health centers, Affinia. They help us to perform outreach events in the community to highlight the need and to increase the vaccination and immunization rates of our school-aged children. So we're really proud of that. And we do a lot of stuff with childcare workers too, right? We know that there have been events in the news of the importance of childcare workers. We know childcare is extremely expensive and it's steadily on the rise. So this is a very sensitive and needed component of our society that we're happy we're able to contribute to. We provide a lot of the CPR first aid trainings that a lot of childcare workers need to keep their certification so they can go to work and they can provide that relief to working dads and moms. So we're really proud of that. Health education, I'm going to go into a little bit more later on the next slide. Show Me Healthy Women. This program is a really important program that we get from a state-funded grant. It focuses on breast and cervical cancer. Nurse Margaret Laycott, we're happy to have her. She's really been instrumental and helped us maintain our services for this focus. We want to make sure that no woman is ever lost to care, right? Sometimes when we get a diagnosis and there's that linkage to care, it just doesn't happen. We've seen it in other arenas of public health. So she works tirelessly with the providers in our area to ensure that all women receive the care and the services and resources that are needed so that they can continue their fight with both breast and cervical cancer and win. Then we have Show Me Wise Women, which is more so focused on holistic women's health. This program actually went on a pause. It wasn't on any part of us or the state health department, but this is a CDC funded program, and there's a revamping of the program. A lot of those minute details are being worked out, and so we're rolling this back out here very soon. Next slide, please. So here's health education. So health education, one of our biggest programs in health education focused on a reduction of hypertension and diabetic rates within the community. We have done this through an assortment of programs. We had 1815, we have 1817, and now we are on STL CDC core. So thank you, Craig, for all of your help and writing those grants and getting us the money that we need so that we were able to provide these services. And then with that, we've worked with a myriad of community agencies And specifically are organizations that can provide access to wholesome groceries. So a lot of times we talk about medical compliance with your doctor, we talk about exercise, and those things are important, but there's also that component of nutrition, right? So you can exercise all you want, you can take the medication, but if your diet is still poor, the cycle towards, or the road to health is not complete. So we have worked with Link Market. That is the picture you see here. And right on this slide, Link Market was one of our food providers in the past for wholesome groceries in food desert areas and promise zones that that we have identified as the city years ago in that fantastic study. And then currently right now we're working with Operation Food Search and Metro Market to do the same thing. And we're currently making plans to expand our reach even with that for the upcoming fiscal year 25. So really proud. These are some of the metrics. I'm not going to go through them for the sake of time that you see that we've successfully have done from 2021 to 2023. I really appreciate Kim pointing out the impact of COVID, because these numbers would have been a lot higher. A lot of these numbers we had large gains in 2022 and 2023 as we got further and further away from COVID. But hey, I want to also shout out my team on this, because CDC recognized our 1815 and 1817 collaborative group, because we continue to do the work in the midst of COVID. A lot of cities and a lot of states, they were handcuffed because of the social distancing measures that took place. We adapted. We started doing registration via phone, and we were still making referral for services also over the phone. So we're really proud of that. And then also before I get to health, men's health, I also want to say this too.
Sorry, Bobby, we're running behind.
I'm
so
sorry.
I'm
Yes,
gonna have to cut you off. It's mostly my fault. So
No. Yes,
I want to get through the last two sections. So just as briefly as you can. Thanks, my love.
Yes, ma'am. I'm sorry. So health with all the work we did with diabetes and hypertension, we also successfully completed an academic journal. So we're proud of that. Then lastly, in health education, we have our men's health and women's health program, preventive health. We're doing a lot of work in that area, and we have the only men's health program in the entire bi-state area. I'm done. Thank you, Dr. Marty. Sorry.
I mean, that takes skill. I will encourage you to take a look at that men's health program. It is one of the cornerstones of what Bobby does. It's the only type in the region. And I really salute your work. Next for fiscal is Emmanuel Kani, one of the most seasoned veterans, someone who propped this bureau up almost by himself when I first joined here, and has now grown this bureau. So Emmanuel, over to you.
Thank you, Dr. Marty, and good morning, everyone. The Fiscal Bureau, we basically play a support role. So all the different things that the programs have talked about, so we play the support role to make sure that invoices get paid, and to just make sure that contracts are put in place. So I would like to introduce Beverly Crawford Brown, who is the accounting manager. She's on the call. We don't have a grant manager at this time. That is one of the positions that is vacant. And we are a team of 14 in the Fiscal Bureau. We have 4 accountants, we have a secretary, we have an auditor, we have a payroll specialist, and then we have the contract management section that is made up of the grant manager, 3 contract compliance officers, and a contract specialist. So one of the major things we do is we manage the budget. So we work with the programs to put the budget together at the beginning of the fiscal year, and work with the budget division to make sure that all of our budget proposals are put in place for us to be able to manage all the different programs that have been talked about on this call. And then after we have the budget in place, the next step is to put contracts. So we establish contracts with our sub-recipients, we work with our program, and also with various city departments to establish contracts that will be carried out throughout the fiscal year. And then once we have contracts in place and services are performed, they will submit invoices for us to pay. So we process those invoices. We work a lot with the Comptroller's office to make sure invoices are paid. And then over the course of the fiscal year, we have financial reporting. So most of our grants, we have to provide yearly reports. Some reports are quarterly, We also have some monthly reports, so we do a lot of reporting on our grants and on our programs. And then we have payroll to make sure people are paid. So fiscal section takes care of that. And then equipment and asset management, we make sure that all of our equipment and assets are properly safeguarded and accounted for. So we have an audit of equipment that we do every year, required by the state and required by audit. So we work a lot with supply division, treasurer's office, comptroller's office, personnel department also. We work with Michelle a lot in terms of making sure people are properly placed and people are hired. So that's just an overview of what the Fiscal Bureau, we provide all the support to all the programs. And thank you for the time this morning.
Thank you so much, Emmanuel. And last but certainly not least is Government Services by one of the most seasoned veteran, former alderman, health equity champion in Craig Schmidt. Craig, you will have to be like a rapper because I have made us very late in time management. So we'll be closing out with you.
Morning, everybody. Thanks for the opportunity. So we all know that policies are one of the most important and foundational, and certainly one of the 10 essential health services. So policies and health and all those policies doing a lot of the foundational bits. You'll see that there's 28 desks here. There are 14 now. Do a lot with internal and external partnerships, try to fill in as a wild card. While we're not always the subject matter expert, we try to fill in where we can and do that leveraging with RFPs, requests for proposals, contracts, invoices, records custodians, some administrative hearings, and connecting people, seeing those connections, and trying to make sure that we can explain why government does and doesn't work and where we can make those changes. And I can explain later when we have more time if you'd like. Thank you very much, Doctor.
Craig, that should be absolutely champion. Please take time to read this next slide. Craig, I've always said, has a role that could be akin to a chief of staff. He is a policy expert. He has brought infrastructure around that, works closely with Commissioner Anwuri. So I apologize that I took some of your shine, Craig, but I appreciate your patience. Last but certainly not least is the very newest, third highest ranking leader, Dr. Cheryl Solares. She has come in to do medical oversight over the City Justice Center. I will not go over it, but I wanted to give her an opportunity to say hello, wave. She is doing God's work, working within CJC with public safety partners. Anything you'd like to say, Dr. Solares?
The only thing I would mention is that I have been in the position to build the CJC healthcare program. I've been in that position now for 80 days. Sort of similar to what Craig said, plenty to tell you, plenty of work going on, and I will take a later opportunity to give you further detail.
Come on, leaders, helping me not get in trouble with my board chair when I'm already in trouble. So we have come to the end. That gives us just under 10 minutes. And if people want to stay extra, I will certainly, for questions, over to you, April.
Thank you all so much. What's really clear to me is that in spite of challenges, lack of resourcing, lack of staffing, this is a team that is committed to keep building the plane as you fly it when you need to. And so I just really want to commend Dr. Mati, your entire team, for just really being examples of how you steward the resources that you do have and how you cultivate collaborations to help get the resources that you need. Because I think that was one of the through lines that I was hearing as everyone was speaking. I also want to say that we may not have much time for questions, but what I would like to maybe think about as we build out future agendas is that maybe have some of these leaders come back and maybe answer some questions that folks have. And also tell us, how can the Board of Health best support your efforts? Where do you have the greatest challenges? Where can we, be the best advocates and champions? for the work that you are doing. How can we help bring collaborations, coordination, other things that you all might be missing or need to deepen? Because that is our role as the Board of Health. Obviously, we're not a body of decision makers, but we are a group of folks that wants to help further the work that you're doing. So I want to make sure that we provide Dr. Mati and the rest of the team, as she wants to bring you forward, to have space to tell us what those tangible things are that we can help you with. We have 5 official minutes left in this meeting. I'm happy to stay a little bit over too, but I'm going to open it up to other members of the board. If you heard something or have questions about behavioral health, communicable disease grants administration, community outreach and information, environmental health services, epidemiology, family, community and school health, fiscal, government services, or medical oversight, please either issue those questions now, or we can collect those questions also, send them to Dr. Mati, and get them answered for members of the board in the next month, so that we can maybe talk more at the June 20th meeting.
Thank you to Morgan for the comment in the chat. If you want to unmute, you can also say it, but I'm happy to field any questions right now or comments.
I don't necessarily have a question, but I just want to celebrate all of the amazing work that, you know, I witnessed today as being, gosh, is it maybe going into my 2nd year of being a board member and seeing just the evolution and growth. Sorry, I have a co-facilitator and I'm trying my best, y'all. But I really just wanted to celebrate each bureau and just seeing the massive, impactful, incredible work, the thoughtfulness. Thank you so much, baby, for sharing. Just wanted to say thank you. My time is limited by other reasons, but I just wanted to share my gratitude to you all. My time.
I'm going to quickly go down the line just to make sure folks have what they need. Ms. Brittany, was this helpful? Anything that you need? And feel free to process, just wanted to check in.
It was very helpful. I'm excited about this work that you all have going on, and I don't have any questions at this time.
We're so happy to have you join. Thank you so much for answering the call. Morgan, you've been such a champion and already working so hard on our behalf. Anything you'd like to add or questions?
Well, I've already messaged Julie Gary, and I'm hoping we can set up a time to chat about what the Bureau of Behavioral Health is doing and how I can kind of become more engaged in sort of a mutually beneficial way. One question I have, which is kind of maybe a big question, is there a map that kind of outlines all of the organizations that the Bureau has relationships with?
Not distinctly, but I love that idea. And I know our EPI colleagues can work on that. So Dr. Moshe, if we can talk offline about doing something like that. And Morgan, if you could just send me some details of how you kind of envision that as well, so that we don't come up with our own version, that would be great. But
we do have a list of all the organizations that are continuously involved with our coalition, in addition to the listserv of all organizations we're connected with. And also linkage to care lists separated by category and types of the population. So I'm happy to share all that with you when we meet, Morgan.
That'd be great. Thank you.
We also have a list of all the stakeholders for the Community Health Improvement Plan. And we've got like all the stakeholders. There's probably over 120 that we started out with, and it's like divided by category and stuff that we could also share with you.
That's really exciting. So I know we have them per bureau, Morgan, but as you heard from the leaders, I want to be clear. Are you thinking about for the whole department? That would be helpful, because We have literally hundreds of stakeholders, so I think there's innovative ways we could do that. And I think a both and approach, but I want to be clear on the call so that I focus on what you need.
Well, I was mostly thinking about the Bureau of Behavioral Health, but yeah.
So Julie has that all for you already.
Okay.
I thought you meant for the whole department, so that's great. Thank you for that question. Thank you for your support. You got dug in immediately, not just with Julie. When I said I need jobs, suddenly I got an HR person from WashU, and it was because Morgan was like, hey, work with Michelle Turner. I just want to acknowledge Michelle Turner. Every time you heard about the growth in workforce capacity, every time you've heard me talk about the increase in staffing by 35%, that's Michelle Turner. She was promoted from my executive assistant to being over everything personnel. She does a lot more functions as an office manager, a counselor child. I basically attribute her training me in this position. Almost 30 years with the city. So just wanted to honor Michelle while she's on the call. Michelle, if you could just say a few words. She doesn't like it. Just say hey, just so they can see you and they know there she is. And it's her birthday this weekend. Happy birthday, beautiful.
Hey, thank you, Dr. Marty.
Happy birthday.
Thank you.
I'll give it back to you, board chair. Those are the remaining board members I saw. I know some people had to leave, but I don't know if I captured everybody, April.
Thank you. We have run out of time for this meeting, but I'll be checking in with members who were both in the meeting and those who were not able to make it, because I think that this meeting will be one of the most viewed on Zoom going into the future. But I am just really thrilled to be able to learn more about what you all are doing. Again, keep telling us what different things that we need to know so we can best advocate to improve public health in the city and help your work. And looking forward to hearing more from each of these teams in the coming months. So I am going to briefly ask if there's any additional news or commentary that folks need to offer up. If not, I will adjourn the meeting.
I just wanted to acknowledge Colleen and some of the veteran boards members for staying. They could have easily been like, we've done this before. That it really says a lot. So thank you, Colleen. I didn't ignore you. I was focusing on new people. But shout out to veteran board members who are like, I'm coming, I'm staying. She's in the chat. So shout out to all our veteran board members who also came and stayed. We will get you a link to this video. We will get you PDFs of the slides. We will get you the CHIP plan all attached in one email for our incredible board chair to distribute. Thank you.
Thank you all so much. I'm going to adjourn this meeting and thank everyone for coming, and we'll see everyone again on June 20th. Thank you.